Hello and welcome to day 7. Today we're going to talk about the upper digestive system. So first of all, we need to know that the digestive system breaks down food for energy and nutrients. The upper digestive system is responsible for intake and early digestion. So think about eating the food and just the process that goes in your upper digestive system. It includes organs involved in swallowing and chemical digestion. Problems in this system lead to diagnostic tests and procedures. Remember that difference between diagnostic and a procedure. The anatomy of the upper digestive system. The main organs include the mouth, that's also known as the oral cavity, salivary glands, the pharynx, it's also known as the throat, the esophagus, the stomach, and the upper portion of the small intestine called the duodenum. Each organ plays a role in moving, breaking down, or preparing food for absorption. So each one of these has a task that involves getting the food in the body, moving through it, breaking it down, and how the body can absorb it. Food enters through the mouth and it's chewed, of course. I think we all know that. Saliva begins our chemical digestion. Swallowing moves food through the pharynx into the esophagus. Peristalsis is what pushes the food to the stomach. The stomach mixes food with acid and enzymes, and then partially digested food moves into the duodenum. Here's common upper digestive terminology. You have oral relating to the mouth, esophageal relating to the esophagus, gastric relating to the stomach, dysphagia, which means difficulty swallowing, GERD, which is also gastroesophageal reflux disease, peptic, relating to digestion, and it's just important to understand these terms and know that they are related to the upper digestive system. Common conditions of the upper digestive system, we just talked about GERD, gastroesophageal reflux, which is also acid reflux. Esophagitis and gastritis, those are inflammation. Esophagitis is inflammation of the esophagus. Gastritis is inflammation of the stomach. Peptic ulcers, hiatal hernia. There are also swallowing disorders involved with the upper digestive system. So these conditions often require imaging, endoscopy, or medication management. Common procedures and tests associated with the upper digestive system: an upper GI series, an EGD. Not going to try to pronounce that word. It's a little hard for me. Just not going to lie to you. Biopsy of stomach or esophagus. Swallow studies are done. Diagnostic imaging. Documentation should clearly state whether the service is diagnostic or therapeutic. So diagnostic is when a procedure is done just to diagnose, just to find out what's wrong. Therapeutic is when it's going in there to treat the condition. So that's the difference between diagnostic and therapeutic. Coding tips for the upper digestive system: identify the specific organ involved, watch for key terms like gastric, esophageal, or duodenal, confirm whether the visit is diagnostic or procedural. Are they being diagnosed or are they being treated? Follow-up care, are they just there for a follow-up? Use the documentation to verify reason for the visit, findings, procedures performed. And the accurate anatomy knowledge helps to support correct CPT and ICD-10 CM code selection.